there a place to
Okay. Good evening. Hello. Good day, good evening, good morning, wherever you are. Welcome to the podcast series Unpacking Decisions. It's a series where we help people be better informed and understand the nuances of a difficult topic and support their effort to participate in shared decision making. We do believe that this will ultimately help them arrive at decisions that resonate with their priorities and improve their quality of life. Patients Engage is a platform that empowers people with chronic conditions and disabilities to engage better with their health and make informed decisions. And we also advocate for more meaningful involvement of people living with long-term conditions. I am Aparna Mittal from Patients Engage, and I'm looking forward to this discussion today on addiction and substance misuse. This is part of our Unpacking podcast series. So addiction and substance misuse is a stigmatized condition. It is complicated, but it is treatable. There are avenues for recovery. And it is complicated also because it doesn't just affect the person living with the condition, but their families as well. So let me first introduce our expert guest here today, Dr. Abhijit Nadkarni, MBBS, DPM, Masters in Psychiatry and Mental Health Services Research, and a PhD as well. He's an NIHR Professor of Global Research and Professor of Global Mental Health at the London School of Hygiene and Tropical Medicine. Also the co-director at LSHTM and King's College. He is an addiction psychiatrist and a global mental health researcher focused on research in developing countries, especially low resource settings. And his host institution in India is Sangath, a mental health NGO, where he is the director of the Addictions Research Group. So he's actively involved in capacity building of mental health researchers and lay health workers in India and in other countries. And he's on the State Mental Health Authority for Goa, State Mental Health Policy Drafting Committee for Maharashtra, and was on the task force for the Ministry of Health and Family Welfare that worked on the mental health guidelines for Ayushman Bharat. So thank you for joining us today, Dr. Abhijit. And we will be talking to people on, we're trying to focus, so just a little point that we will focus largely, while addiction or substance misuse is a large topic, we will focus largely on tobacco, alcohol, and a little bit on drugs. This is being live streamed, so if you do have questions, you can post or you can share it later as well, and we will try and get back to as many of the questions as possible. So thank you once again for joining with us today, Dr. Abhijit. And we can start by, what is addiction? I think maybe we can just start with that.
Sure. Thanks, Aparna. Firstly, it's a pleasure to be here with you on this podcast. And while I might be biased, I think this is an important topic which needs discussion, both in professional as well as lay public circles. So it's great to be here and kind of try to unpack some of these issues, so to say, around addictions and substance use disorders. So we mentioned addictions and we mentioned substance use disorders as well, and these are not kind of completely interchangeable, but to some extent. And if we could look at addictions as the larger umbrella within which substance use disorders sit. So one could kind of, if you want to put it very simply, addiction is basically using a substance or indulging in a behavior to an extent that it starts causing harm, and you continue doing it despite knowing that it's causing harm. That's kind of the simple explanation of it. And when one starts kind of either using the substance or kind of indulging in a behavior, it does not necessarily cause harm. But over time, with repeated use, with extensive use, using too frequently, using too much, or doing things too frequently, doing things too much, so both in terms of the intensity and the frequency, there start to happen changes in the brain, both in terms of the structure of the brain and the chemicals or the neurotransmitters that are operating in the brain, which then makes it increasingly difficult to stop the behavior or stop using the substance, even if one wants to. And so broadly, it's a collection of uh, the physiology, which is kind of the biological things happening inside the body, the psychology, which is, thoughts, emotions, etc., and behaviors, things that we do. And it's the combination of this which makes addictions kind of the syndrome that it is. And if
Right.
we talk about it in terms of substances, then we can call it substance use disorders.
Right. Right. So as I said, we will focus largely on tobacco, alcohol, and maybe a little bit drugs. Do you find that, as you said, addiction is a larger umbrella? While we will focus on substance, there are also behavioral addictions these days and digital addictions. Can you just quickly, while we won't go into the detail, but just for the audience, kind of differentiate between the 3 or 4 if there are others?
Sure, absolutely. I mean, we could kind of broadly break it, and there are finer nuances in that, but we could broadly break it down into use of substances, which we'll delve into a slightly more detail kind of later. And then there's behaviors or behavioral addictions. And so, as the name suggests, you're not using a substance, it's a behavior that you are indulging it over and over again with greater intensity, with greater frequency, and it's causing harm, and you're unable to stop doing those behaviors, even if you want to, or if someone has told you it's causing harm, you know that it's causing harm, but you are not able to control it. And examples of this could like gambling, and it used to be kind of in-person gambling before. Now you have other modalities of gambling, including online gaming, etc. But also other behavioral addictions like video gaming or gaming or the internet or social media. All of these are behaviors to which one can get addicted to, and which might, while there might be, again, differences and nuances, some of the things that I spoke about earlier with regards to substance addictions or substance use disorders would apply to behaviors as well, which is, you keep doing it despite knowing that there's harm. There's a lot more kind of psychological and social harm in behavioral addictions as compared to physical harm, which is more likely to happen in substance use disorders. So some of the symptoms that you might get, for example, in substances, i.e., when you stop using it, you might get physiological or biological withdrawals, which are physical, which might not happen with behavioral addictions, but psychological withdrawals, would happen. And then the other things like craving, which is, if you stop doing it, you want to get back to it as soon as possible. Spending a lot of your time indulging yourself in that behavior, you needing to do more and more of it to get the same effect, are some of the things which kind of are common threads which run across behavioral and substance. So there are similarities and there are differences, both in terms of how they manifest, the harm that they cause, and the treatment modalities as well, but there are also differences.
Right. So there's also these terms which are used, right? And you use substance use disorder, there's substance abuse that you will sometimes hear, and then there's misuse. Are these all the same? Are they different? Again, you can kind of unpack that.
So there are kind of, there have been shifts in terms of how this terminology has been used over time, but also across geography. So for example, depending on which part of the world you are in, you would say misuse versus abuse. Or let's say, for example, a term like alcoholism or alcoholic. You wouldn't use that in Europe anymore because it's a very stigmatized terminology, but it's commonly used in the US.
Right.
In professional circles, I mean, not in lay language. So there are variations in how some of this terminology has evolved over time, and a lot of the shifts has occurred because of a greater understanding of these conditions, but also in terms of what happens, why it happens, etc. But also a greater awareness about how some of the terms that we use, how some of the terminology that we use is not very useful. It's stigmatizing, and it's not really, in some sense scientific. It's kind of creates barriers to access help, and kind of that understanding has also led to evolution of some of this language over time. But as I said, there are variations across geographies as well. I think it's we shouldn't get too caught up in the terminology because it just leads to more confusion. If you were to ask me what could be the one, what is it that I would prefer to use, I would prefer to use substance use disorder. Because one, it's kind of, it's non-stigmatizing. It kind of puts you within the kind of the scientific use of some of this terminology. And then based on what kind of substance it is, you could say alcohol use disorder, so
Right.
so I prefer use disorder as something that's non-stigmatizing, a lot more scientific. But I think it's not as much the terminology as what it means that's important. And what it means is some of the things that I spoke about earlier. You need to use more and more of it to get the same effect. You get withdrawals when you stop it. Instead of you controlling the use, the substance or the behavior is controlling you, and which means that you can't stop it even if you try very hard, even if you want to. So these are
Right.
kind of the core features, and those
Right.
are the ones we should be focused on rather than what it is called. As long as we ensure that we are not using stigmatizing terminology, because that's not very helpful at all.
Right. And therefore, you already answered the question as to when substance use becomes a problem, right? Because you've described the key features of the addictive behavior, and therefore defined what it is when it becomes a problem. I guess also the question is that we don't, if somebody likes something, like somebody likes cold drinks, we don't call them as addicted to cold drinks, right? So why are some products termed as substances or addictive in nature, whereas others are not?
Right. Okay. An interesting question. If let's say cold drinks, I mean, if cold drinks met the same criteria that I spoke about earlier, you would of course call them addictive. The thing is that they don't meet that criteria, right? So in the sense that using or drinking cold drinks on a regular basis, let's say, for example, a lot of it on a regular basis, will cause health problems. Obviously, they're not healthy, will cause health problems, but they are not, as far as what we know at this point, they do not cause changes in your brain, let's say structure or function, which makes you difficult to stop them. They might become a habit, which is a lot more kind of behavioral and psychological, but there's no physiological changes happening in your brain which makes you kind of do it, right? So I think, to me, that's the kind of the fundamental or core difference between things that we do as a habit. Let's say
like coffee drinking is a habit for some
coffee
people.
drinking, right? But then coffee does have a substance, right? Caffeine, which can cause an addiction. So caffeine does cause an addiction, and people, if they stop caffeine intake, if they have been kind of can get withdrawals. But I mean, simple things like let's say my diet being terrible, and I like to eat junk food, and I know that it's harmful. I'm putting on weight. My doctor has told me that it's harmful, and I just can't stop it because it's become a habit, right? And but it's not causing a change in my brain as far as we know at the moment.
Although now they are saying for junk food that it is
exactly
got the same, right?
Exactly, it's a reward. So
process.
that's why I keep saying as far as we know at the moment, because the science there has not reached a stage where we can say like it's causing all of that. But obviously there are certain, it's serving a certain function, and that's why people keep doing, like, behaviors repeat because they serve a function. We don't repeat behaviors just for the heck of it. It's serving certain function for certain people, and hence we keep doing it. But to me, the core thing is, and then again I come back to saying, as far as we know at the moment, it's not causing those kind of changes in the brain which kind of forces you to keep going back to that substance.
Right. So also there is this feeling, right, that some people may less in tobacco, but more in kind of alcohol, etc. Right? A lot of people can consume alcohol, but not kind of get it doesn't become a disorder, whereas for other people it does become. So, there is this whole discussion that happens whether it's a personal failing of the person or is it a complex issue impacted by, other history behind that person or something else. What again is, what are we understanding now on things like that?
Yeah.
What makes somebody more likely to get, have a behavioral problem or a substance use disorder?
Yeah, I think that's been this whole thing about whether it's a personal / moral failure / weakness versus the biological condition has been a long-standing debate, and as we kind of understand more and more of the condition, uh, we kind of are able to articulate a lot better on what might be causing it. But even without that understanding, it's definitely not a moral or a personal failure. I think it's while there is while we have to understand that there is autonomy involved in using it, like someone is using it and there's certain amount of autonomy in the use of the substance or behavior. There's also certain things that for certain people are out of their control, right? And trying to kind of purely formulate it as a choice that a person is, they're doing it because there's some kind of moral weakness or failing is not helpful to anyone.
Right.
Right. Neither to the person who is kind of struggling with it or the people who are trying to help him. It's not helpful at all, because then it's an absolute, right? You can't do anything about it. So in that sense, it's not helpful at all. Then the question is, what causes some people to develop a disorder and not others? And the causality is complex, right? It's not one single thing in most people. And let's just kind of very briefly look at the various things which could explain some of this. And let me kind of address it to some extent, which is usually the elephant in the room, which is the biological substrates of it, right? Because on the one hand, people will speak about the moral failings, weakness, etc. But on the other hand, people would kind of want to park everything at the door of biological substrates or genetics. Like, it runs in the family. And that's also not very helpful, because if that's the case, then it's again an absolute.
And it takes away agency, right? Yeah.
So let's kind of look at that first. So while there are biological substrates to addictions, and these are in terms of, let's say, how genetically we are wired to metabolize some of these substances or break them down, and the effect it might have on us. Those are some of the kind of the genetic propensities that people might have, which might run in families. But the most important thing to remember is that everyone who has this genetic propensity will not go on to develop a substance use disorder. That's one. Right. And the second thing is the converse of that. Everyone who has a substance use disorder does not necessarily have a biological substrate to explain it, right? So that's the first thing to remember. It might increase your risk of developing a substance use disorder because you have the genetic propensity, but it is not destiny, right? Just because you have it doesn't mean that you'll die.
Right.
So that's the biological bits of it. And then there are other things. So for example, developmental. Also, what happens as you grow up? I mean, as a child, say, for example. So trauma in childhood and child abuse, those kind of then create a risk for developing substance use in the future.
Right.
Mental health problems. And when I say mental health problems, I'm not just talking about something that can be diagnosed and say, you have a depressive disorder, but just certain characteristics or certain experiences that we might have, which puts you at greater risk of using substances as self-medication. So for example, I might not have an anxiety disorder, but I might be anxious by nature.
Right.
Right? So, like, let's say in a social situations, I find it difficult to interact with people. And if I have that, a little bit of alcohol, I open up, it makes it easier for me to interact with people. And my brain learns that, if I do this, I'm better at interacting with people. And so I keep doing it, right? So
Right.
I might not have an anxiety disorder. Or I might kind of, life affects me much more than it affects other people. I might not have depressive disorder, but I feel low much more easily than other people. And I realize that if I drink alcohol or I smoke, it helps me deal with that better. And so I keep doing it, right? So that could be another reason to do it. Then there are social determinants, like poverty, unemployment, social norms
Right.
around drinking, right? Like what are the social, and we see this at country levels, right? Like countries which have social norms around drinking, which are well established, which kind of tells you, culturally tells you when, where, how much to drink, what to do after you had alcohol, how you can behave, how you cannot behave. If you have cultural norms, they're less likely to develop problems. If there are no cultural norms, they're kind of more likely to develop problems in their populations. And then the biggest one, which we generally don't talk about, is the commercial determinants, right? So advertise, like how aggressively alcohol is advertised, how easily is it available. There's evidence to show that the greater the density of alcohol stores or shops in a locality or neighborhood, greater chances of people developing drinking problems in that neighborhood. Or the price of alcohol, there is clear evidence to show that less expensive the alcohol is, greater chances of at a population level developing alcohol problems. So there's various different things that come into the picture, and then it's just a complex condition which requires interaction of these various different things. And so to kind of to put an extreme kind of analogy to it, you need a perfect storm of these things to happen for someone to develop alcohol. Obviously, in certain cases, there might be just that one thing that has happened, which is big enough to drive someone into developing an alcohol problem. But in most cases, it's a combination of all of these, one or more of these things.
Right. And often people therefore make this statement, right? Whether it is alcohol or even tobacco use will be, you can't afford food, but you will spend on alcohol or you will spend on tobacco. Again, how do you see that and how would you explain that? Or the other example that you often hear is, if you think you have stress or, look at the kind of stress XYZ is having to deal with, but they don't have that, substance use disorder.
Yeah. Yeah, so two different things, and both interesting ones. So let me just take one at a time. So the first one about you might not have food on your plate, or you might not have money to pay the fees of your child's school fees, but you're still kind of drinking alcohol, using tobacco. So that's true, does happen. But I think we need to understand why that happens, right? Because we generally, again, kind of, when the lay public talks about it most of the times, you kind of putting it in under that basket of a personal failure, right? You kind of saying that you have a choice between buying food for a family and drinking alcohol, and you voluntarily choose to drink alcohol and not buy food for a family.
Right.
I would like to shift that formulation a little bit, because if you have a substance use disorder, in this case, alcohol use disorder, I am, in some sense, not in control of it. So I am forced by my brain to go and buy that alcohol. It's not as if I don't know that if I don't buy that alcohol, I can buy food for my family. I know it. I feel guilty about it the next day. But at that moment, because I'm controlled by the alcohol, because I have a disorder, I have no choice. But I go ahead and do that. Right? It's different from someone who doesn't have a disorder, right? And then I'm just drinking alcohol, sometimes, and I'm choosing today to kind of buy a bottle of expensive alcohol instead of buying food for my family. That's different. That's a choice that you're making. But if you have a disorder, the choice is constricted. And a lot of your time and brain energy is spent on thinking about alcohol, how am I going to get it? How am I going to drink it? Drinking it, and then getting over the effects of the alcohol. And so that those choices become constricted around the drinking. And so it's important to realize that, it's true that this can happen, what you described, but why it happens, like our thinking around why it happens, that
Right.
needs to kind of shift a little bit.
Right.
That does not necessarily make the outcomes of it any less, problematic or difficult for the family or the child. That still happens.
Right.
I mean, the child will still suffer if they are not getting nutritious food. The child will still suffer, let's say, for example, the school
They
fees are
don't
not
get the
getting.
fees. Yeah, paid.
So that outcome is still negative. There's no doubt about that. I'm not trying to explain or I'm not trying to justify that.
Yeah.
What I'm trying to say is why it happens is kind of different from why we think it happens.
Right.
And the second one was about
stress levels. The stress levels.
Stress levels. Yes, of course. Yeah, thanks. So so that's also let's try to think of an analogy of what could be a good analogy. Why? Oh yeah, I can't think of a good one at the moment. But the thing is this: all of us experience stress. Right. I mean, it's a part of life. I mean, I'll be surprised if anyone comes and tells me that I have never experienced stress. So all of us experience stress. Our thresholds of being able to kind of see it as a stress or otherwise varies. And our abilities to deal with stress and the skills and tools that we have to deal with stress differs. And when people use alcohol or a substance as a way of dealing with stress, it just means that they might not have, one is the threshold might be lower for experiencing stress, and the other one might be that they might not have the tools to deal with the stress in what one could say in a healthy way. You might not have healthy stress. You might not have these tools to kind of deal with your stress in a healthy manner. Right. And hence you kind of use an unhealthy coping mechanism. If that person, and we are only talking about this in the context of stress management, okay, not all of the other things that I spoke about. Right. And if the person has the appropriate tools to deal with stress, it's quite possible that they might not go to alcohol. So for example, let's say problem solving skills. Or emotional regulation skills. If I don't have them, if I don't have good emotional regulation skills, and let's say something happens and I lose my temper, I don't know how to manage it. Alcohol might help me manage it, right? And so I'm using it as a tool to manage that. Right. So it's not that some people can manage it, can manage it without using alcohol, and other people need alcohol for it on a blank slate. I mean, you have to understand that there is a reason why a person is choosing, because they don't have the other appropriate tools to do it. Right. And sometimes if you look at some of the psychological interventions that are used for treatment of some of the substance use conditions, they involve teaching or training that person in developing those skills. Right. So that you don't use the substance as a crutch to help yourself. How to regulate your emotions, how to manage your stress, how to deal with problems are some of the things that are taught within psychological interventions. Right.
And you've used kind of alcohol, but it would be the same with tobacco as well, right? Or smoking cigarettes or smokeless tobacco. Is it the similar?
Yeah, no, absolutely. I mean, the kind of, there might be finer nuances and variations, but if you some people use alcohol for stress management, some people use smoking, and you hear people very clearly telling, when I'm stressed, my smoking goes up.
Yes.
And that also means that, let's say, for example, in terms of looking at it in terms of your recovery journey, that becomes a barrier sometimes, right? Or a trigger for relapse. Kind of you stopped, and many times recovery is a kind of a relapse remission journey, right? You have ups and downs, and when you speak to people who have kind of abstained and then relapsed, they will tell you that, something happened, I was stressed, and I kind of started off, I thought I'll
Right.
use it once and I'll be fine. And then you kind of get into that slippery slope.
Right, right. So yeah, so that's a good way to segue into our, second segment, which is on recovery. Can a person overcome a substance use disorder? And, if so, again, broadly, what are the steps that are followed? And I know you've already said recovery is not a straight line, but if you can talk about that a little bit.
Sure, absolutely. So, I mean, the first thing is recovery is possible, right? And we wouldn't be doing any of these things if we kind of
Correct.
thought it was not possible. That's one. And you're right. I mean, it's not a straight line. Everyone has a different recovery journey, right? And I kind of I use and when I say I use it, it's not I haven't invented it. A lot of people working in this space use the chronic disease analogy, right? Like diabetes.
Right.
That once diagnosis of diabetes happens, you diet, exercise, medications, and then there are ups and downs, right? So there'll be times when your blood sugar is out of control and the doctor tweaks your medication or whatever. So it's not a straight journey. But for some people it might be. You start treatment and things are fine for several years. And so same with addiction. So you make a diagnosis, you start a treatment plan, the person decides to change, and they change, they stop, reduce, and for some people that's it. I mean, for the rest of their life they will never use. For other people, they might not use it for a long period and then they might relapse, and then you come back into treatment, you get better, and then for some people it's kind of multiple ups and downs. For some it might be like multiple ups and downs for the beginning of their journey, and then eventually they kind of stop or kind of reduce control, whatever their goal is. For some, that might never happen. It's a continuous journey. And then there are others who something happens, a life event, a major life event, and then they stop and never go back to it. So like things like a major life event, getting married or having a child, anything, a lot of things, or being diagnosed with a kind of a physical
condition
illness.
like a cancer or something. Yeah.
Exactly. So there are various different types of journeys people have. How does it kind of not steps, but some of the things that I think are helpful in getting onto this journey? I think the first and the most important step is an honest reflection on what's happening, an acknowledgement that here is a problem that I have,
Right.
and I need to do something about it. I think that's the first step. I mean, in the absence of that, the next steps do not follow. So that's the first step. Then the next step would be identifying the appropriate kind of resources to help you. Sometimes people do it by themselves. Sometimes people do it with the help of family and friends. Sometimes you need professional help to do it. And if you're opting for professional help, then identifying the right person, right resource to kind of help you. Engaging with that, because it's not a one-off thing, it's an ongoing process. So engaging with it and kind of working with the professional that you're working with. Depending on the kind of substance or the behavior it is, the kind of the treatment package, so to say, would be one or more of medications, psychological intervention, and a social intervention, right? So these are the three core components of a treatment package, so to say, and this will vary based on what's the kind of substance, how severe the problem is, what the person's choice is in terms of what they would want to do, etc. And then kind of engaging with that. Strengthening your kind of social networks, family, people around you to support you is very important. Ensuring that and again, some of this becomes a part of the treatment process itself. Ensuring that you are aware of the potential triggers for relapse, because one of the biggest stumbling blocks, so to say, that I've seen is when people kind of acknowledge, come, seek help, get better, as in, let's say they stop the drinking, and then the overconfidence sets in, and it's like, I've done it, I'm fine now, and not paying attention to what could happen next, because there are going to be several triggers. And
Right.
understanding those triggers and having backup plans in place to deal with the triggers becomes very important,
Right.
right? Because the triggers are unavoidable, because the triggers are part of our life,
Life.
right?
Right. Right.
Like stress, or friends with whom you used to drink, or the place where you used to drink, or parties where you used to drink. I mean, those things are going to happen.
Right.
You can't avoid them. Most of the
Hmm.
times you can't avoid them. You need to have a plan to how to deal with that, and you need to have that plan in advance,
Hmm.
right? That you can't start thinking of the plan after you had your first drink,
Right. Right.
right? Because that's not the time or the place, because you won't be able to do that. So having that plan in place to deal with triggers, knowing, and finally kind of knowing that this is not a one-off thing. It's recovery is a long-standing process, and
Hmm.
I need to be investing it on a day-to-day basis.
Right.
So hence we keep saying that it's stopping the substance is not the difficult part.
Right.
Remaining stopped is the difficult part, and that's the journey. That's the recovery journey, right? One chooses to, I'll stop from tomorrow. That's a single decision,
Right.
and you stop. But the kind of the difficult part starts after that. That is remaining
Hmm.
stopped, and that requires preparation, practice, and having a certain mindset. I
Right.
think these are kind of broadly some of the things that I can think of, which are the steps in the recovery journey.
And you know, in this recovery conversation, there are also terms like there's a term called harm reduction, right, which is used. Um, can you again elaborate when is it relevant, etc.? And second thing that, and I don't know if it's related, some people when they kind of stop will completely stop, right? Especially with less so with tobacco, but although you do have some people who will say, I will occasionally kind of smoke in a social setting, but not on a regular basis. But with alcohol, you do see that some people need to stop completely, go off it, whereas some people can still be a social drinker. So again, uh, if you can kind of shed some light on those areas.
Yeah, sure. So so let's see. So what would be ideal in terms of outcomes, health, social, psychological outcomes, physical, psychological, social outcomes, would be not having the substance which is causing you the problem, right?
Right.
That's just logical, right? If something is causing a problem, if you're no longer there, it's not going to cause you problems. But in many cases, for many people, for
Hmm.
a range of reasons, that might not be possible.
Right.
Uh, and then the option is between something that's the best versus something that's the good. And as we
Hmm.
again within this space say, don't let the best be the enemy of the good.
Right. Right.
So if in the absence of that best, if you're not able to stop completely, what can we do to reduce the immediate short-term problems or kind of disadvantages or the risks that happen with substance use, and work on that?
Hmm.
So and this would vary depending on the substance that we're talking about, right? And this doesn't apply as much to tobacco, because in tobacco, stopping is the goal, right?
Hmm.
Because it's the smoking that or the it's chewed tobacco that's causing the problem. It's not the nicotine as much as the things that are there within the cigarettes that causing the problem.
Right.
But let's look at alcohol. So for alcohol, there is an option. If you are not able to completely abstain, there's an option to have controlled drinking.
Hmm.
And this is quite different from reduced drinking. Okay, reduced drinking does not mean anything, right? It's so vague. If you're drinking a bottle of, let's say, whiskey every day, you could say, I'm going to drink a 3/4 bottle of whiskey a day. I mean, that's reduced drinking, but it doesn't mean anything. By the time you have your 3/4, you've forgotten that you've decided you had a 3/4, and you finished a whole bottle, right? So controlled drinking is where you have a clear goal on how much you're going to drink,
Hmm.
when you're going to drink, where you're going to drink, how many days of the week, let's say, for example, you're going to drink. So that's a very clear goal. Let's say, for
Right.
example, you're drinking every day and you say, now I'm going to drink only 3 days a week.
Hmm.
And I'm going to have gaps between that. So I'll drink on a Monday, Thursday, and a Saturday, for example, and not on the other days. And when I drink on a Monday, Thursday, and a Saturday, I'm going to have only, let's say, 2 pegs of whiskey and nothing more. So that's your goal. And then you need to build a plan of how you're going to do it. Because if you don't have that plan, you're not going to be able to do it. So for example, let's say you kind of drink, you go to a pub to drink, and you're going to say, I'm not going to take my cards with me. I'm just going to take cash with me. I'm just going to take enough cash to pay for 2 drinks.
Hmm.
And so once you finish that money, that's it. You can't buy anymore. I mean, like you go to your regular shop, you might get things on credit. So you have to plan for that as well. But I'm just giving an example of what could possibly be done. Or you say, I will have my first drink of, let's say, whiskey. I'll have my first drink, and then I will have a cold drink or an aerated drink or just a soda, as we call it.
Yeah.
And that means that your stomach is filling up, right? And you don't have something more. Or I will have my meal before I go to the pub, which means there's not enough space in the stomach to have a lot of alcohol, but also the absorption of alcohol is also reduced because there's, So having a plan is very important. So control not drinking is not just about reduced drinking. 2 things need to happen. One, you need to have a clear definition of what it is and how you're going to do it. So those are the things that drinking. So that's an example of harm reduction in alcohol use, right? Or the type of alcohol that you drink. You go from high kind of things like high alcohol content, spirits, to drinking beer. Right. So kind of that's harm reduction, let's say, for alcohol. For other substances, like let's say take the example of opiates, right? If you are injecting heroin and you can't stop, then you reduce the potential harm. So one of the harm that can happen with injecting opiate users is that you share syringes and needles. Right, and which means that the problem is not with the opiates, the problem is with HIV and hepatitis, right? So you ensure that people get clean syringes. So you're still using the opiate, but chances of getting HIV or hepatitis is reduced. You create safe spaces for people to use where it's supervised, so you kind of ensuring that how people use it's safer. Or you ensure that people have naloxone, which is the antidote for overdose of you give people those syringes to keep with them, preloaded syringes to use with them. If there's an overdose, then someone can give it to you, right? And you don't die because of opiate overdose. So those are the kinds of harm minimization things or harm reduction things that you do. So the idea is, if you can't abstain completely, we try to reduce the risks that can occur with continued use. So that's what harm reduction is about. There was a second part to your question, isn't it?
No, we talked already about that, because I was asking about how some people may not, may want to become a social drinker. So we already covered that. You talked of kind of 3 pillars of recovery, right? You talked of, depending on the substance use, but medicine, psychological support, and social support. What do you see as the role of, where does support groups come in, and how important is, let's just do first support groups, if there is a role there, and do you see, is there evidence of, support groups being helpful? And then we'll come to the next question around psychological support.
Sure. No, there is evidence of support groups. So, for example, 12-step facilitation. So that there is an evidence for support groups. And what it basically, what support groups do is one is peer support, right? I mean, there are other people who are going through the same or similar kind of issues that you're struggling with, right? So sometimes universalization of a problem helps you kind of realize that, okay, there is hope, I can do something about this. Other people have done it, they've gone through similar things, and so that's the universalization of the problem, is how groups work. So the other thing is in terms of allowing you to share strategies that might have worked for you or might not have worked for you, what might be your barriers. So you kind of share with each other and learn from each other's experiences, and you provide support in that manner. So definitely, I mean, if there are the issue is like they're not easily available everywhere. right? So if they're available, there is a role.
Right.
The second issue is they might be available, but they might not be suitable for everyone, right? So everyone does not necessarily do well in groups.
Right. Right.
So some people prefer it, some people don't. Some people might prefer, one-to-one interactions with a therapist or a psychologist. Some because they struggle in groups, and so it's not for everyone, but
Right.
for those who are comfortable with it and it is available, there is evidence about groups that.
Right. And coming to the psychological support again, is that a necessity, or there are, ways of, and given that we do struggle, I mean, first of all, especially in a country like India, which is out of pocket, it's an expensive option, as well as there may not be as many trained psychologists out there.
Yeah, I mean, that's access has been an issue for the longest time, but there is no way around it, So whilst medications might have some role in certain kinds of use disorders. So for example, let's say alcohol, there is a role for if you are dependent on alcohol and you have to detoxify and come off the alcohol, quote unquote, cold turkey is not the best idea because it's very risky. And people can die, sometimes when they go cold turkey from alcohol dependence. So there's a role for medication to reduce the impact of kind of the withdrawals, but that's a limited role. And then there is a role for some medications to reduce craving for alcohol. But psychological interventions are an important kind of part of that. To a certain extent, if people don't need medications, I would kind of recommend psychological interventions as something you could work with, even if you don't have the medications for craving. But by themselves, medications, in the absence of psychological interventions, usually doesn't work or is not a great idea. So while access is an issue, and it's a systems level issue we need to solve. But in terms of what is needed, psychological interventions become increasingly important. Having said that, while access is an issue, there is a growing evidence from India, from the work that we have done, other people have done, other parts of the developing world, which has shown that psychological, what we call as low intensity psychological interventions, which can be delivered by non-specialists, and who are not psychiatrists or psychologists, are effective in helping people to reduce their alcohol use or stop their alcohol use. So while access is an issue, there's a solution to it. And there are ways in which we have a long way to go into kind of translating this into, policy and kind of making this available on the ground. But there's evidence to show that you don't really always need a psychiatrist and psychologist to be able to provide good quality psychological interventions for people with substance use disorders.
That's great. So coming to the social support, right? So one of the challenges that you'll often hear is that, because you said the first step is actually to acknowledge that there's a problem, and that does not happen so easily. People will deny that it's a problem, and the family and friends will want to figure out how to get somebody onto a recovery program. And obviously you can't get somebody on a recovery program unless they acknowledge that it's a problem, right? So what can they do what can family and friends, can they do anything, if at all? If yes, then what? And if not, then what's their best way of dealing with that situation?
I think just as it's for the person who's using the substance, it's important for them to have an honest reflection on what the issue is. It's important for the family members or those who want to support the person with the substance use to have these honest conversations with them, acknowledging the problem. And this has to be obviously done in an empathetic manner. It has to be done in a non-judgmental manner. And it has to be done at the right time. What happens most of the times, not always, but most of the times, is when we have these conversations with the person when they have used the substance, which is not the greatest time to have a kind of a logical conversations with anyone, right? So kind of having the right conversation in an empathetic manner, in a non-judgmental manner, at the right time, and pitching it at the right level is very important. That's the first thing. Second thing is not kind of, guilt induction again becomes a very big part of the conversation. You try to make people feel guilty about what they are doing. And this happens not just with family members, this happens in professional circles as well. Even doctors will do that, right? Or scaring the person into stopping their substance use.
Right.
Doesn't work. I mean, if it was that easy, you could just scare everyone and they would stop you. It doesn't work. And the reason the person continues using is that it's gone beyond that fear. Like what they're getting from the substance is much bigger
Much more than that.
than the disadvantages that they can see. Right. So having that conversation in an appropriate manner with them without trying to induce guilt or kind of scaring people into stopping is very important. Providing appropriate amount of both logistical and psychological support in that journey towards recovery is important. So when I say logistical support, ensuring that if they, let's say they said they agreed, okay, I want to go to a professional, then getting that appointment, reminding them of the appointment, helping them to get them to that appointment. That kind of logistical support is very important. Psychological support in terms of helping them to implement the strategies that they might want to put into place to reduce or stop their drinking. So for example, if they have said I'm going to drink only at home as a strategy, because if I go out I'm going to drink a lot, then ensuring that, reminding them, ensuring that they do it only at home. Or if they say, after I had my second drink, when I go to a party, if after I have my second drink, please remind me that I've had two and I've decided I'm not going to have three. Kind of helping them in kind of implementing those strategies becomes very important. So that's like the psychological support. Just ensuring that they strengthen their social networks, which, sometimes when you kind of get caught up in addictions, your social circle starts shrinking. Ensuring that there are other things for them to do, which are outside of their drinking. So these are some of the things that families can do. And very importantly, I think it's, families and people who want, like any loved ones or any significant other who wants to help, it's important for them to also remember that at the end of the day, there is autonomy in some of these things. Right? You can't force a person to change. There are certain things that you can do, but there are certain things that you cannot do. And accepting that and stepping back at the right moment is very important, because otherwise you kind of putting more stress on yourself. And a final thing that a family member or significant other loved one should do is to be mindful that their own psychological, emotional well-being is very important, because it's very easy to get caught up into that whole thing that happens around a person's addiction. And it's in India, it's increasingly difficult because of the sociocentric nature of our culture and society. It becomes increasingly difficult for a family member to dissociate themselves from that. And that leads to more stress to that person. And you have to remember that if I'm stressed, if I'm psychologically unwell, I can't help the other person. So it's important to be able to disengage, take care of your own well-being, take time out for yourself, so that you can help the other person better. Remembering that is very important.
And during the recovery process, I know you talked of a few things. Is there anything else that you, kind of, because, that while you said that, okay, if the person wants to be reminded after 2 drinks, etc., right? But there must be a mechanism of how you do that, because otherwise it doesn't work, right? Even though it's been agreed, it can lead to a difficult situation.
No, absolutely. Of course, yeah. So, I mean, some of these things get dealt with in therapy. I mean, I've tried to simplify some of these things. So, for example, So, for example, in a situation where there is a history of intimate partner violence or domestic violence, right, where trying to set some of these boundaries can trigger off violence, there would be ways in which you would do it or not do it at all. So, I mean, there are nuances to some of these things. I've kind of tried to simplify some of these things, but when you kind of go through therapy, some of these things get dealt with, and you are the therapist will equip you, the family member, with the appropriate skills and what to say, when to say, how to say some of these things,
So
right?
is
So
there a need for family therapy as well and not just individual therapy?
two different things: individual
Hmm.
therapy, family therapy. Again, what works for people is what you would go for. But even if it is individual therapy, there
Right.
is, in my opinion, always a role to engage the family member. It might not be family therapy, which
Hmm.
is kind of working as with the family as a unit.
Unit,
But
right.
even if it's an individual therapy, there is a need to engage at whatever intensity you feel appropriate, the family member, to kind of help with some of these things. And both
Right.
in terms of understanding the addiction, but also in terms of how they could possibly help the person. So it's not family therapy.
Okay.
It's quite different. You're kind of
Right.
giving them independent skills to be able to help it. Family therapy is kind of dealing with it as a
Family
unit
unit.
to kind of look at how the dynamics play out in terms of the addictions and helping out with those.
Right. Right. Okay, thanks. And I think one final question on that was, you know, I mean, the normal thing would be that, okay, can we prevent future generations to develop substance use disorders, right? So, any inputs for parents out there who, what can they do to prevent, because we are seeing younger and younger kids.
Yeah, absolutely, absolutely.
So I think.
The age of initiation of substance use in India, especially tobacco and alcohol, is going down on a kind of regular or kind of an annual basis. You can see the age going down. And the most important to remember is the 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 earlier the initiation of substances, the greater the chances of developing problems in the future. So the whole goal of prevention is, if you can't stop, you kind of try to delay initiation as much as possible, both in terms of future problems of addictions, but also the fact that when substances have an impact on the developing brain, there are greater kind of impacts, adverse impacts that happen. What parents can do, I think, a lot of things, a lot of things. So one is to have, again, honest, open conversations with children. Uh, as early as possible, when you think that they understand these things and you believe that they're going to get exposed to these things, right? Again, in a non-judgmental manner. The moment you start kind of putting the morality narrative onto this, we have to remember that young people's brains are designed to take risks. This is unavoidable. That's how brain develop. They are going to take risks because that's how you learn and how you grow. So if you tell them no, you shouldn't be doing it, they're more likely to kind of try to push that boundary, because that's how young people are wired to behave or respond. So having an honest conversation around the risks, and kind of giving appropriate information, and in a non-judgmental manner, as early as you think they're going to get exposed or they will understand these conversations. That's very important. Modeling behaviors is very important. So if you're going to have this conversation that I spoke about earlier while you are smoking a cigarette or having a pack yourself, that's kind of not setting the right model. And again, modeling of behaviors is very important for young people, and they kind of look towards other people, important people in their lives, to model their behaviors, either consciously or subconsciously or unconsciously. So kind of modeling the appropriate behaviors becomes very important. Third thing is being aware of what's happening in a young person's lives. What are they doing? Where are they going? Who are they meeting? Who are their friends? What are their friends doing? Being aware of that is very important. Setting clear boundaries around what is acceptable and what is not acceptable, and what are the consequences of the acceptable behaviors, is very important. Ensuring that you put in place appropriate buffers and things that will increase the resilience of the young person becomes very important. And what do I mean by that? Ensuring that they have good problem solving skills, ensuring that they have good emotional regulation skills, ensuring that they have good skills to deal with peer pressure. All of those things are a part of resilience. So you try to reduce the risk factors and you try to enhance the protective factors. And some of these life skills become very important. Either you kind of help them acquire them, or you kind of create or kind of ensure that they are in a system, whether it's a school or wherever, where they kind of are able to access these and learn these skills, becomes very, very important.
Thank you. Any one key takeaway? I think we are on the hours. We should wrap up.
Yes. I think the key takeaway, if you were to ask me, would be that one, addictions are very common. They are different types.
Right.
They are complex. Why it happens is very complex. But very importantly, if they do happen, there are ways in which we can counter them, both in terms of preventing them, but also treating them. And remembering that there are various ways in which you can help yourself and others can help you. And finally, remembering that recovery is a long journey and you have to commit to that long journey.
Right. Thank you. Thank you so much, Dr. Abhijit Nadkarni, for taking the time. And thank you to our audience. And I think always remember, recovery is possible. So it's not a straight line, but it is possible. You'll have to work through it and you'll need the support of friends and family. And as I think Dr. Abhijit said, remaining stopped is a challenge, like any chronic condition. So keep that in mind as well. So thank you so much for your time, Dr. Abhijit, and thank you for talking about this.
Thanks, Aparna. It's been a pleasure. All right, then. Take care. Bye-bye.
Thank you. Bye.